The meeting recording will be shared on HCA website on a page dedicated to SURSAC meeting information. The meeting recording is open to public disclosure requests. Please do not disclose any private or confidential information. We will no longer use a verbal roll call so that we may use that time for other agency agenda items. However, we ask SURSAC members that you take a moment to enter your full name and the area you representation you serve on the committee into the chat so we can all be reminded of the wide range of representation we have within the committee. Language and terminology. Use people first language, e.g. person experiencing homelessness rather than homeless person. Use the term substance use rather than substance abuse or addiction, which is stigmatizing. Avoid using the term addict, person first language alternative, person with a substance use disorder, or a person who uses drugs. When someone forgets to use these terms, assume that their intent is still good and be gentle with reminders to use agreed upon language. The resources I can give them if needed. Guidelines for public feedback. We will usually allocate 10 minutes at the beginning of the meeting and 5 more minutes near the end of the meeting for public comment. Each person will have three minutes to provide feedback. Public comment on each agenda item will be invited after the committee has provided its comment, ensuring dedicated time for public input before moving into the next item. If you are not a committee member and would like to comment during the discussion, please raise your hand to bring it to the facilitator's attention. Feedback that is not provided during the meeting can be submitted via email at any time to hcaesb5476@hca.wa.gov. This is today's agenda, and I'd like to go ahead and pass it off now to Tisha.
Hey, Kelly, thank you.
Yep.
Good morning, everyone. Just want to do a quick sound check. Can everyone hear me all right?
Yes, I can hear you.
Oh, thank you. Thank you. I appreciate that.
You're welcome.
So good morning, everyone. I am Tisha Kirschbaum, and I'm the Director of the Division of Behavioral Health and Recovery here at the Healthcare Authority. I'm here today because I wanted to be able to share some information and give some updates when it comes to the budget process. I'm sure many of you are aware that Governor Ferguson released late last week his budget proposals and priorities. And they look different than the budget that Governor Inslee had released a few months prior. This is because we are in a budget shortfall. And while the Inslee administration did have some cuts, a big way that they look to kind of balance out that budget shortfall is they did propose some tax increases. As Governor Ferguson, the new administration, has come along, they are also putting forward a budget which was just released, and it is looking at how do we work to balance the budget in a different way. So this is not a fun conversation to have or a fun place to be in, and we are looking at a very different budget scenario than our state has been in for the past few budget sessions. So some of the reductions that were put forward would affect many of the programs that this particular SURSAC is very focused on. Some of the cuts that particularly might affect the behavioral health, some of the reductions that particularly were put forward that were different than you might have seen in the past were some reductions to just overall behavioral health rates. Also a reduction to the Recovery Navigator funding, and also some reduction in funding for long-term civil commitments. I think it's really important to also remember that this is only the first step of a process. The budget that we will have to work with next year is not decided on yet. We are still going through the legislative process. Typically, the first step in the legislative process is the governor's office providing a budget, which has now happened, and then also the legislature also provides budgets, and then through compromise and lots of conversations, we have a final and active budget at the end of session that this year will probably be near the beginning of May. Happy to answer any questions people might have or provide any additional information on this topic.
And I'll just add real quick, and good morning, everyone. Kelly did put a link in the chat where you can find more information about the budget reduction process and what the proposals are and have some of that background information. Sorry, Tisha.
Oh, please, I appreciate it. We are also having just a little bit of technical difficulty in the room. So if I'm looking at different people's laptops, it's just because we don't see it on the big screen.
Any updates on the funding report? This is from James Tillett. Any committee member, any updates on the funding report Davis discussed at our last meeting regarding opiate and alcohol taxes?
I can answer that. I'll be dropping that bill soon. Any bill that increases state revenue is not subject to cutoff, and we tend to deal with revenue bills, tax increase type stuff at the very end of session. So I'll let folks know when it has a bill number.
We have another question in the chat from Brandy Flood, committee member. When will we know how much the cuts are to RPN?
Great question. So we won't know exactly what the budget looks like until the end of session. And this is really a step in the process. And these are simply suggestions or the proposals that the governor's office put forward. And the legislature and the governor's office now really are looking at ways of what is the best solution to be able to get to a finalized budget. And so I guess that's just a long-winded way of saying we're not sure and we won't know exactly what that looks like until session ends in May.
And adding to that, another key date that the committee might be interested in is March 18th, which I believe is going to be when the new revenue forecast is released, which will give a clearer guidance as to how much of a budget deficit Washington State is facing. It may change. And so we can share the information once it's public and we can send it out to the SURSAC committee if that would be helpful.
We have a hand raised. Malika Lamont, committee member. Go ahead, Malika.
Yes, I'm sorry I was a little bit late. So what I'm hearing, how will that impact this work as far as like this particular planning group with these projected budget reductions, or do you not feel comfortable answering that at this time?
I'm not sure I have a really strong answer for that. I think what we know is that we're not quite sure what the budget is going to look like until we get to the end of session.
Hi, everyone. Can you hear me?
Yeah, go ahead.
Yes.
Okay, this is Kimmy. I'm the director of the Recovery Navigator Program in King County. Susan dropped a question in the chat. It says, I know the governor said that all programs that were added in the last 2 years would be cut as well. What behavioral health programs do you think will fall into that category? I would like to know the answer to that as well.
So I believe that was some of the guidance that was first provided by Governor Ferguson when he said to the executive branch agencies, hey, we need to do some budget reduction scenarios, please take a look at some programs that have recently been implemented. It was one of the suggestions, not you must cut all programs that have been implemented in the past 2 years. Each state agency did go through a budget reduction exercise where we had to hit specific targets and how much general fund state dollar we would be cutting. We did complete those budget reduction scenarios. We submitted them to our Office of Fiscal Management, and then the governor's office did use that information to put forward his proposed budget. Not everything that was suggested for potential reductions or not every scenario was accepted, or not everything that every agency put forward in each scenario was accepted or put into Governor Ferguson's budget. You can see the full list of what those proposed budget scenarios are on the OFM website, and we can put that link into the chat. So I think it's I'm sorry, go ahead.
Yeah, no, I appreciate that. I pulled up the link and I'm looking through it. I also would like to ask, so since all of that went to the governor to be looked at, did you also receive, or did the governor also receive the return on investments from these programs?
This is
'Cause I think that would be worth looking at, honestly.
Yeah.
In addition to that, I'm wondering if sorry, Susan, I just saw your hand go up. But it seems to me like we're in a crisis as far as, and the government seems, I mean, not the government, the governor seems to have recognized this as well, that, public safety and the provision of public safety and what that, actually entails, is in a really bad way as far as like in our state. And Recovery Navigator programs and lead and arrest and jail alternatives are all pressure valves for that system. And I'm wondering if it was framed in such a manner that the governor's office was able to understand that. Because this is the loss of infrastructure in communities, which typically isn't something that is put up for cuts.
This was a very, very difficult exercise that the Healthcare Authority and all of the state agencies had to go through and put forward. I would say that none of it was taken lightly, and it was all extremely hard decisions. Where we really had to look at is, where do we have general fund state dollars, and where are some potential reductions that could be made? And we continue to advocate for how much benefit the Recovery Navigator Program and many of these other programs that you just highlighted, how much difference they are making.
Just go ahead and go with Susan. Susan, go ahead.
Thank you. So I just want to be really clear that I think I heard you say that,
Susan,
yeah,
sorry, can you introduce yourself just for awareness?
absolutely. And my misstep. So thank you. My name is Susan PC, and I'm the Recovery Navigator Project Manager, and I work for King County and their regional admin position. And thanks for the protocol. I just want to make sure that I understand what I think was just said was that that the department that you're representing was part of the decision-making process to cut RMP by half. And that was what was recommended to the governor and that he accepted. So I wanted to make sure that it isn't placed on the governor. That's not where the decision was made. He accepted it, and I understand that was his decision, but the decision was made at HCA level. Is that Is that what I was hearing? I heard that it was difficult, but I want to clarify where the decision was originated.
That is correct. We did decide on the budget scenarios that would be moving forward.
So it is with HCA and not the governor.
Our job was to put forward the budget reduction scenarios. Yes.
I'd just like
Natasha,
to
go ahead.
add that that feels really inappropriate. And I'll stop.
All right, Natasha.
Yeah, quick question. So as far as like when you were looking at the, proposed budget cuts, et cetera, as far as different programs, were you also looking at data as far as, what programs are actually working? What, are we getting good feedback from individuals and families? Like, because RNP is a huge program within so many, the whole entire Washington state. So this is going to be a huge loss. 50%, that's huge. I'm just wondering what data was looked at I'm a behavioral health advocate, ombudsman currently, or previously known as. And I can tell you right now that I haven't gotten any complaints from anybody from the Recovery Navigator Program or using that program at all. But I can give you a list of other ones that for sure. So I'm really concerned about where we're getting this and why that decision was made.
What I can tell you is that it was a really hard decision. Where we mostly looked at is where do we have general fund state dollars. From that narrowed our pool of options we had for putting forward to complete the budget reduction exercises. I do want to clarify, and I know all of you understand this. So this is one step in the process. We do not know what the final budget will look like, or if or how it will actually affect the Recovery Navigator Program.
So did you look at data though? I mean, like the WISE program, the Youth Navigator Program, there's all these different other programs that so many complaints. What are we looking at? What's basing your decision on taking away half the funding for this program specifically is what I'm asking.
So that's a really good question. And I'll go back to a large part of what we were looking at is following the instructions and looking at where do we have general fund state, and then making those reductions based on that. Which is why some of those other programs you were just referencing do have more of a stronger tie to Medicaid, which made them more challenging to cut, made them more challenging to put in part of the budget reduction scenarios.
All right. Any more questions on this subject?
It's like Kimmy Reedy has their hand up.
I think Kimmy just commented.
No, I didn't. This
Oh,
is
you did
Kimmy.
not? Well, I'm
No,
sorry, Kimmy.
sorry,
Kimmy,
that's okay.
If you can
So-
introduce yourself too, because you don't
Again,
have it
yes,
noted.
yes. I am Kimmy, the director for the Recovery Navigator Program with King County, Pierre, Washington. And I don't fault anyone for having to make hard choices, especially when it's not about your program, right? So what I want to ask here is, who do I need to get the information in front of so that it can be looked at differently as far as return on investment and things like that? Like, who can I send that information to for the next steps?
That is a great question. So right now, the governor has put forward his proposals. The legislative process is still in session. Both the House and the Senate have not released their budgets yet, and those would be great places for advocates to continue to work through the legislative process with.
Okay, but no specific person?
Well, for yourself, if I would honestly often for the legislative process, it's best to look where your program is located, who the elected official is. I
Yep.
believe Representative Davis is on the
Yes.
call. I'm sure she probably already has and is always interested in receiving that information.
Yep. Awesome. Okay, thank you very much.
All right. We are way past time on this. Right now, we're going to take Rep Davis and then quickly from Susan Piercy, and then we're going to move on. Go ahead, Rep Davis.
Yeah, thank you. I was also very disappointed both that HCA offered up RNP for cuts. I believe HCA's offered complete elimination of the program, and the governor elected to eliminate half of the program. I have already expressed that to the governor's staff, senior staff directly. I think I always joke that RNP is the best kept secret, but I do think we need to not be so secret in how incredible this program is. It is the only recovery program that exists in every county. It was funded, as people know, on sort of a rural equity funding model. So we have a minimum of 2 recovery navigators, even in the most rural counties. So it has great appeal for all legislative districts. It is, in my humble opinion, perhaps the most effective behavioral health program the state has ever funded, and it took years to staff up. And so what might be helpful is if folks want to reach out to my office and kind of coordinate a letter to the governor's office and to the budget writers in both the Senate and the House, the operating budget writers specifically, requesting that this program be maintained in full. I also wanted to note for HCA's edification in terms of your conversations with the governor's office. So it's correct that the Recovery Navigator Program, as originally envisioned, is funded entirely with the state general fund. And just for folks who may be a little bit less familiar, GFS, or general fund state, is basically the state's most flexible dollars that we collect from sales tax and property tax and business and occupation tax. And we can use it for anything, K-12 education, paying for parks or prisons or anything the state pays for. And so it is the most kind of competitive money. And this program is a large chunk of it. I believe the maintenance level funding is $22 million per year. And so I do have a bill currently, House Bill 1427, that directs the Healthcare Authority. That bill's currently in the Rules Committee, so it's advanced through the Healthcare Committee and out of appropriations, directs the Healthcare Authority to look at contracting with an entity to come up with low barrier, cost-effective mechanisms to potentially offload some of the cost of this program to Medicaid, because a lot of it, we do have Medicaid billing codes for pre-treatment outreach services delivered by peers, and a lot of this could be scooped up, and it's not currently. There's a lot of rigor involved in billing Medicaid, and so part of the goal of that subcontract will be to figure out how we can do that in a way that's not unduly burdensome to agencies, and where we get more than the cost benefit sort of makes sense, and that we reduce the rigor involved in behavioral health agency licensure, which is a prerequisite to Medicaid billing. So just wanted to flag that for folks and for the agency, so that you can perhaps communicate to the governor's office and remind them that the intention is to start to move this to more of a Medicaid blended funding model. Thank you.
All right, Susan, and then we have to move on, folks.
I'll make mine brief. My name is Susan PC. I am the Recovery Navigator regional admin for King County. I just want to really ask sincerely that I heard that the decision was difficult, but what I did not hear answered was any reason why. So I am really interested in the reasons and how it became on the list to get rid of. Not that it was difficult. I know decisions like this are difficult. I appreciate that. But I really want to know. And I'd also like to know who at HCA to contact. I know I can contact the governor and my legislators, but I'm interested of who needs to get the information about RNP at the HCA level. Who made the decision?
So it was always a reduction, not an elimination, for the budget reduction scenarios that HCA, DBHR, myself put forward. I think for advocating for who to talk to individually, it would be myself, and also Mary Ann Lindeblad, our director, would be good people to talk to about the benefits of the Recovery Navigator Program. And it also came down to, thank you, Representative Davis, how you just described Medicaid and some of our programs that use blended funding with Medicaid. Different budget reductions were put forward, and we did look at the programs that had the most general fund state. It did put forward reductions connected to those programs. We're really looking at what are some of, unfortunately, we have so many really good programs, and we did start looking at what are some of the programs that are not core Medicaid entitlement services, and then also looking at what were some of our programs that were funded through general fund state. And then that list got very small.
All right. Malika, go ahead. We'll move on.
I just wanted to draw people's attention to the chat. There is a letter being formed, and Carol Ann Sanders will be sending that out to folks. And so I would just say, all RMP folks, look in your email. There will be a sign-on letter coming through. Thank you.
All right. All right, next item on the agenda, we have any kind of committee announcements that need to be made or would like to be made by any committee members? Is there anything that that committee members would like other folks to know?
And then maybe Blake, while pausing for a second for that, any additional updates, just wanted to thank Tisha for being here, for sharing this information and going through what the process was, and really appreciate the comments, questions, and concerns that were uplifted by our committee members as well as guests within the within our committee as well.
Okay. Any public comments? We had a previous discussion. Anybody have any comments from the public? Please go ahead and raise your hand if you do. All right, Rep. Davis.
I'm not the public, but I also wonder, I don't think SURSAC has ever done this, but I wonder about a letter from SURSAC too, right? This body was convened by the state. It's an artifact of the state in the wake of the Blake decision. The RNP was the cornerstone, is the cornerstone of the state's response to the Blake decision. That would be another, potentially a possibility, or HCA can tell me if that's allowable.
I don't know. I'm gonna have to check with our legislative affairs and maybe Division of Legal Services on that. It does feel like, just at first glance within the scope of the committee, given the connection with Recovery Navigator Program. But we can follow up with relative staff at the Healthcare Authority and then send a follow-up email to the SURSAC committee to give additional guidance on that proposal.
Thank you, Tony. I'm going to actually, Amber, I'm going to take your question here. I'm going to move to Lisa real quick since she is not a member. And this is public comment, and then we'll get to you. Thank you. Lisa, go ahead.
Good morning, everyone, and apologies if this repeats what members or staff said already, but I do see really profound tension between that approach to budget and recommendation and the governor's stated commitment to hold harmless public safety efforts. These are quintessential public safety efforts. So I think there's a misunderstanding about kind of the impact and policy place of this work, and that would be, it would behoove us, I think, to highlight that this is a solution to a set of problems that otherwise falls to the criminal legal system that cannot possibly absorb them. So it would not be holding public safety harmless for these programs to see a reduction. Indeed, they probably need to scale. So hope that we can all hold on to that theme. Thank you.
Thank you. Amber, go ahead.
Morning, everyone. So my my question is, underneath that, it says eliminate proposed expansion of Blake programs. And I'm just like brought to mind of all the work we've done here in SURSAC with our recommendations and the things that we were called upon to recommend to the Senate and to legislature. And is that what that means? Is that because I kind of feel like that means that all of our work and our recommendations are just moot. I just want to make sure that that's what I'm reading.
So I believe what you're seeing is you're looking at the OFM's, the budget reduction scenarios on the OFM website, and one of the eliminations that was put forward was the decision package that got accepted in Governor Inslee's budget for some of the improvements or additions to we call it the Blake DP.
Which was 5536, right?
I'm bad at the 4-digit numbers. There's so many. Is that the correct 4?
Yeah, Amber, yeah, that was a decision package to support implementation of programs under 5536, the 2023 legislation, not 5476, the 2021 legislation. But just to clarify, those were included on HCA's original submission to OFM for consideration, but I don't see them reflected on the governor's proposed budget reductions. Whether or not that decision package will be funded, like we've been saying, we won't know until April, until there's a final convened operating budget for the next biennium. But those were not all of the Blake programs. They were additional funding that we identified needing specifically for the diversion data integration platform, for the behavioral health services mapping tool, and for Michelle. Yeah, there was a number on there, and we can, it might still be on the OFM website under agency budget proposals, and we can get that link out, but
Yeah, I'm just concerned that all the work that we were called upon to do, and all the recommendations that we were asked to make, and then the recommendations that were accepted are now, because they were so new, or they might be considered an expansion of the Blake decision, might just be like swept off the desk, and that's disheartening.
I mean, we don't know what the final budget's going to look like. We know there's a deficit. We don't know exactly how much, but I mean, it is possible when there is a final budget that some of those other programs may be included in it, and included in a reduction. So, I mean, there is a lot of unknowns, but at the same time, understand the concern. And also want to do a quick temperature check, because we did invite Kimberly Wright here to give a legislative update. However, Kim only has 5 minutes at this point. And so, Kim, appreciate you being here, appreciate you preparing. And also, if the committee is okay, we can send that update through email. And then I'd like to just kind of highlight some comments in the chat real quick, and we can take the next 5 minutes on this topic, because it feels like questions are continuing to kind of come up. And if that's all right, if I can get like some thumbs from the committee members, if that makes sense. We just don't have enough time for a legislative update at this point. I don't see any thumbs, but I'm just going to go ahead and proceed with that plan. So just making some note of some comments in the chat, because this is, as everyone knows, it's streamed on TBW. It's kept, we keep a record of these meetings, and that doesn't include the chat. And so Brandy Flood mentioned that our federal government may be cutting Medicaid. So I think that is a good reminder to everyone that as part of the federal budget process, the House Appropriations directed the committee that oversees Medicaid to identify $880 billion in Medicaid savings. And Seattle Times covered this recently, and we can get a link to that article to everyone. But I just wanted to flag that Brandy mentioned that in the chat. Julian Saucier, another SURSAC member, indicated give our programs a free year. Give our programs a few years. Tax the rich, just saying. Then we also have Susan PC asked a question. When curious about other Blake programs, such as the HOST program, will that see cuts as well? I think we already addressed that. As of now, it wasn't referenced in Governor Ferguson's proposed budget reductions, but at the same time, we won't have any clear answers to some of these questions until there's a final budget. And then Robin Kozad, I'm sorry, as I get older, my eyesight's horrible. Robin Kozad indicated, we have done an informational exercise and report in assessing cost reduction from the Recovery Navigator Program, even in just one area. We estimated over 5 million in savings from just getting individuals licensed. Many of our rural counties have no other low barrier options and cannot fund their own, and we are saving county and state funds through this work. Medicaid rating could be helpful as a funding mechanism, but knowing how up in the air Medicaid is, it's worrying. 1115 would be a natural fit, but the current federal administration could potentially end waiver programs to reduce Medicaid further and place the burden of costs once again on the state. It would also tie our hands in providing a low barrier support as possible and will impact our ability to work with other behavioral health agencies if the work is competing. And then just a couple other quick notes from the chat. Emily Hurio from Department of Health provided a link to Governor Ferguson's public announcement last week. And so just want to direct everyone's attention to that. And Susan PC indicated, I'm not as interested in hearing what we can do with legislators. I am asking curious about if HCA also suggested other cuts such as HOST. And Susan, you can reference the document on the OFM website to see all of the original proposals that the Healthcare Authority submitted to the governor's office and OFM for consideration. And then finally, Kimmy Reedy again indicated, I have shared this here before. However, RNP King County with Pierre Washington has an ROI for over $8 million in the first year and a half in regards to jail. ROI in that context is return on investment. Took me a second. For the first year and a half in regards to jail services, I will be doing a deep dive and sending all the up-to-date information from our organization about jail overdose, hospitalizations, 911 calls, etc. Sorry, I felt like a lot of that content that was being shared in the chat just needed to be verbalized and captured for purposes of the record for somebody that might be watching this at a later time. With that, we have 1 minute before we start talking about Recovery Navigator Program data. So I just wanted to see if anyone from the committee had a final comment or question, or if anybody from the public as well. Real quick, I want to address Rep. Davis's comment in the chat indicating HOST is also funded with 100% general fund state. So it is curious that HCA did not propose cuts there. And I believe that's because we were directed to maintain homeless and housing programs.
And that was one of the suggestions, yes.
And so HOST, for those that aren't aware, stands for Homeless Outreach Stabilization Transition Programs. But yeah, good question and good point.
All right, Tony, you want to move on to the RMP with Brianna?
I think we're going to need to, yeah, because there's a lot of content there. And I know when we share our data for the Recovery Navigator Program, we always have a good conversation, a good dialogue, good questions and comments. And I want to make sure we have time for that because it is, obviously it's relative to this conversation as well. And so Brianna, if you're ready, we'd like to kind of kick it off to you. And yeah. Is Brianna, Rachel, is Brianna here? Brianna, if you're talking, you might be muted. And while Brianna gets ready, just want to point out that Representative Davis in the chat indicated that RNP is both a housing and public safety program, both of which the governor directed to be preserved.
Brianna, can you hear us? Not sure that she's on.
She's here. I mean, I see her attending. Just
Brianna, maybe you're maybe log out of Teams and log back in. That usually helps me when I'm having kind of audio issues. Sometimes my headphones disconnect.
Can you hear me?
Yeah.
Yes, now we
Oh.
can.
I guess when everyone muted all, I was like muted in some form that I couldn't unmute myself. So I had to switch my microphone to something else. So I apologize. Am I sharing? Can you see my screen?
No, we cannot
yet.
see your screen.
Can anybody see my screen?
No.
Oh, that's very weird.
If you send it to me, I can present for you.
I sent it
Rachel
to
can.
you. Yeah, I sent it to you on Friday.
All right, give me 1 second. I can.
Yeah,
pull that
I
up.
don't. It says I'm sharing, so I'm not sure why.
Maybe stop sharing and then try again and see if that works.
For some reason it says only meeting organizers and presenters can share, and it's not allowing me to be either. That's weird.
Rachel, can you make her a organizer?
I can do that right now.
Okay. Really apologize. Sorry
no
for the technical
worries.
difficulties.
No,
Again,
it's a
I
good
had
cause.
I had no internet until like 3 minutes before this meeting started, so I'm like really, really sorry about the technical difficulties. But I'm excited about our presentation.
Go ahead and give it a try.
And what?
Go ahead and give it a try. Try to present.
It's still not.
Well, go ahead and
Trying.
stop presenting and then present again. No, we're not saying that. I have it marked as everyone can present. So.
Okay, hang on 1 second.
Well, I'm ready. I can do it. Brianna, is that okay? Would you like me to present it? I'll go ahead and present it so we can get going.
Yeah, it's still not showing. I'm not sure why.
That is odd. Okay.
Oh, wait. Maybe.
All right.
Maybe. Can everyone see?
There it is.
Yay! Yay. Okay.
Thank you.
I'm excited. Hello everyone. Brianna Peterson. I am, and for the purposes of this meeting, I am the report administrator for RNP, Recovery Navigator Program. I want to say good morning and welcome. Thank you for joining us today. We're here presenting the Recovery Navigator Quarterly Report covering Q3 of 2024. It's the calendar year, so that's July through September 2024. I appreciate your time and commitment in supporting individuals through the Recovery Navigator Program. Before we dive into the data, I really do want to take a moment to acknowledge the collective efforts of our BHASOs, our partners, the law enforcement agency partners, our community organizations, and our out there on the streets outreach workers. The work we do is complex and we face many challenges, but we also see real impact. Individuals accessing services, engaging in recovery, and making positive changes in their lives. As we go through this presentation, I just want to take a moment to have you guys think about what stands out to you in this presentation. Where are some areas that you see progress, any gaps, or any areas for further improvement? We are constantly collecting the feedback from this group and reviewing for current and future updates to the workbook, our data collection, and the subsequent report.
Hey, Brianna, real quick, are you still on the title slide, or did you advance?
I'm on title.
Oh, okay, cool. I just wanted to make sure, like with the other, okay, sweet. Thank you. Go ahead. Sorry to
Yeah.
interrupt.
No, in today's presentation, we'll be providing insights into referral and outreach data, case management trends, and some system or data collection improvements that we've made over time. I'm also going to be highlighting some key successes and some areas that we are currently improving. And we will also be discussing how SURSAC feedback has informed our approach to this report. We are still continuing to work towards that public-facing dashboard and hope to have a timeline soon. We do have an internal work group that's meeting every other week, and we're getting closer. I promise we're getting closer. It's just taking some time as we're refined and constantly making data process improvements and reviewing the data to make sure that it's as accurate as we can possibly make it. Please see the reporting schedule for the following SURSAC meetings and the reporting periods that will be reported on those dates. Okay, and we'll begin with the referral and outreach data. In Q3, we engage with 3,091 estimated unduplicated individuals through referral and outreach. The 613 referrals came from law enforcement, showing a strong collaboration in connecting individuals to services. 72% of cases were responded within 15 minutes, which reflects the efficiency of our rapid engagement efforts. So thank you to all the providers for being so on top of it. As part of the 3,091 individuals, 883 enrolled in case management. That includes light and intensive case management. It's good to note that referral and outreach services is the first connection point, but enrollment to case management is based on client needs and willingness to engage in ongoing services. Our engagement doesn't end there, though. Providers continue to build trust and rapport so that individuals can see that case management is a beneficial option. And you can see here our top referral reasons. General SUD seems to be the top one here, following along with homeless and housing and possession. As we reviewed this slide, we noticed that there seemed to be an increase in law enforcement referrals, so we decided to highlight this effort in this slide here. So here we have quarter by quarter the total of unique individuals seen per quarter and the law enforcement percentage of referrals in those quarters. And you can see that we are on a beautiful trend line going up. This indicates a strong collaboration and a shifting approach towards supportive rather than punitive interventions.
Sorry, Brianna, real quick. I thought I saw a hand, so I don't know.
Is there? I can't see, so you're gonna have to, stop me. Yeah.
No hand. It was applause.
Oh, okay.
Okay. Every time an officer refers to someone to RNP, they are helping to interrupt cycles of crisis, incarceration, and overdose. It's about harm reduction in real time, connecting individuals to services rather than the criminal justice system. Here's the gender and race distribution for our referral and outreach. Again, as we go through this, please feel free to provide any feedback or any areas where you would like to see highlights like we previously saw, or what data points would be helpful to see in a different way or progress over time. And again, as noted from the last, there is no other. We've found that that's not what the option was. We were just grouping the refused and not provided into one, and that's what previously was other. Now we're naming it as it is appropriate. It's they either refused to answer or did not provide an answer. And now we'll get into case management. We've had 2,609 unique individuals who received case management services. This includes the 883 new enrollees from referral and outreach and 1,726 ongoing clients from previous quarters who continue to receive case management. And here's some the top 5 direct care services and top referral to services. As you can see, some of our top reasons for direct care services is that client support services and peer support. The client support services focuses on tangible assistance, such as helping get driver's license or social security or any type of financial aid or navigating through our social services. And peer support is more like mentorship based. You're working with people who have lived experience, who offer emotional and recovery focused guidance. I will say that one area that you might see missing here is the contingency management or incentive-based encounters. Based on your feedback, we recognize that there may have been some inconsistencies in how those terms are defined and used and applied across the different teams or providers and in our data tracking. We would like to try to be consistent with our definition, ensuring accurate data collection, reporting, and evaluation of the impacts of that service. We're also trying to gain a shared understanding of what those providers are doing, allowing providers and case managers and partners to align their approaches. We are currently working with BHASOs to develop that shared understanding of these concepts, and we're conducting an internal review of the findings, and we'll bring these insights to SURSAC for further discussion and any recommendations of how to report on it in the future. We are exploring potential updates to data collection protocols to ensure that case management and incentive-based encounters are properly distinguished. This data point is, as it is, removed here until further discussion can be.
And Brianna, it looks like there's a question, a couple things in the chat. Lisa Dugard indicated, note that homelessness response is leading point of contact. I think this was in reference to the referral and outreach slide. And then Caleb asked, how much direct care is SUD treatment harm reduction related? So I think in the top 5 direct care services, how much of that is tied to SUD treatment or harm reduction? And direct care and referral services are duplicated. They can have more than one question mark.
At this time, well, I'll start from the bottom up. At this time, we cannot duplicate. Is it selecting more than one? They can't at this time. I mean, RNP is supposed to be a harm reduction approach, so a lot of these are geared towards that harm reduction. A lot of the case managers and the outreach workers, have lived experience and can provide that support. I think the BHASOs can probably, or providers on the call can probably answer that better if they're willing to.
Wait, the follow-up to that is there information about topics and modes of communication for the peer support work? I think that's something we can probably take back, right? Get some more data.
Yeah, I'm wondering if it's in some of our documentation that we have currently. I'll have to review and look that over with Ryan, and we can see what we can come up with and provide to this group.
Thank you.
Yeah. And now on to the case management, race and gender distribution. One thing to highlight here, I couldn't make a I couldn't make a proper diagram to show this, but so I pulled the information myself, and I just wanted to just state it out loud. So the refused and not provided, you can see, is at 14%. This has steadily declined over the past 3 quarters. In quarter 1, it was 22%. In quarter 2 is 18%. And now in quarter 3, we're at 14%. This demonstrates stronger engagement strategies and clients becoming more comfortable with sharing information. It also highlights the improvements that case managers have made, building that trust and explaining the importance of demographic tracking. So really kudos to the providers and the case managers. Exceptional job getting that information and having those numbers go down. And now let's talk about the feedback from SURSAC. So we've been collecting your feedback since March 2022, which is, I think, the first time that we've reported out on RNP. And the individual level data was enhanced in the version 6, which is what people are using. And we're now that it included now demographic information such as race, ethnicity, and housing status to improve equity tracking and case management. We're also working towards improving tracking to referral follow-ups, ensuring that we can better measure successful connections to services. We've established our internal RNP data work group in June 2024, and we began discussions for EdFX and PDAMs with it, which is a data collection, data validation tool for this data to provide more clean, efficient data. Moving forward, we'll be developing a way to incorporate feedback from the March 2024 meeting, which will further align data elements from other state outreach programs. And based on the last meeting in November, we'll be introducing additional reporting categories such as health engagement hubs to improve the accuracy of service tracking in the next workbook update. I understand that you may not see all the feedback that you provided over the years, since I only had one little slide for this, but we have and will continue to collect this information and work within our current resources to address the concerns or requests. We continue to improve our programs by focusing on areas including strengthening referral pathways, particularly with law enforcement and community organizations, refining case management data collection, ensuring accuracy and consistency across outreach programs, and we will continue to align our efforts with statewide recovery initiatives. This slide will also serve as a primer for future discussions, so expect to see these topics brought up in upcoming meetings when updates are made to ensure transparency and to collect feedback. We are constantly reviewing our process improvement for data collection and processes when it comes to the workbooks and reporting. And with that, the contact information. I will also add that I am the appropriate contact for any public disclosure requests for any regional level data. And at this point, I'm opening for questions or further discussion.
All right, questions for Brianna?
Yeah, if you want to. While committee members are thinking of any questions, just kind of flagging that Caleb shared in the chat a follow-up link indicating here's an older example of how we documented care navigation activities, which has been very helpful information for understanding more about what exactly occurred. And there's a link there to an ADAI program or report. I haven't had a chance to look at it yet, but Caleb, thanks for sharing that. And then Kimmy indicated, I can answer the first portion of that question. 100% of RNP King County, Pierre, Washington is harm reduction related, as well as SUD and mental health treatment. Thanks, Kimmy.
All right, Malika, go ahead.
So, this is just, I don't actually even know who to really direct this question to, because of the way this meeting has been going. But, there was some really, challenging information that was shared at the beginning of the meeting that directly impacted a lot of the people that pour their heart and soul into this work. And then to have a presentation where that's recognized, but also have the knowledge that there's huge funding cuts that have been proposed by the very entity that is giving a presentation that shows that this work is that it is in alignment with the governor's priorities. It just feels, it almost feels disingenuous, or maybe like there's some cognitive dissonance occurring, or tone deaf. I mean, it was hard to hear it in the context with which the decision-making process was shared. And to see that there is data that directly aligns with, I mean, we've had many, I think all of us can admit that there's been a lot of challenges with the data over the years. But the thing that was demonstrated by this data was that what's occurring is directly in alignment with the governor's priorities. So just for future reference, I guess, can there be some more mindfulness towards that in the delivery of this kind of information?
Yeah, I can address that, and appreciate the thought behind that, Malika. I mean, I will say that Governor Ferguson just released this information on Thursday, and we wanted to have a conversation about it sooner than later. And luckily, Tisha was available for some of this time, and so that's why. I mean, it definitely wasn't an intentional effort to kind of piggyback those two conversations, but it's how it timed out with how recent that information was shared from the governor's office. And so, but yeah, I mean, noted. And I think, some of these data are extremely helpful. And if we get guidance or approval to submit a letter to the legislature, we can include some of these data points within that on behalf of SURSAC. So I'll definitely follow up on that question that came through earlier. And then just also flagging, I mean, we talked about this back in December, right? Like OFM originally asked the state agencies to submit potential budget reductions back on November 8th, and RNP was listed on that document as well. And so, I understand and I share the concern about losing these sort of critical programs, especially as our next agenda item, we're going to start talking about the rise in simple possession case filings across Washington state. I'll stop there.
Can I add something, Tony?
Oh, certainly. Yeah, sorry.
So I just want to just make note. I understand, like there's a lot. It impacts my position too. Like this directly affects me, and so I understand a lot of the concerns and the frustration. But what I really want to emphasize is that regardless of a lot of areas where we didn't have funding, we still tried to come together as adult SUD and try to rope in as many of our internal partners as we can to help with the data collection, to help with trying to come up with solutions internally, even when we didn't have the money to do so. I understand that it's substantially a lot more money, but we do strive to make a lot of efforts when there isn't funding available to make things happen internally as best as we can, because it is important to us. It does matter to us. It's very important.
Thank you, Brianna. Malika, did you have another comment? Oh, no. Okay. Brandy, go ahead.
Never mind.
Tony, I appreciate your comments earlier, and we did talk about this earlier in the year, but we never talked about the healthcare authority suggesting a 50% reduction in RMP. So that's shocking to me. It may have something to do with people having health efforts and public health efforts confused with public safety efforts. And so that is concerning to me, that maybe healthcare authority didn't take a public safety approach. And, I know there had to be cuts, but not 50% of cuts, that you're going to kind of dismantle infrastructure that has put forth a lot of reductions in funding and the approach that the RMP has to doing this work. And so that's what's, I think, most concerning and mind-boggling, just in relation to Malika's comments. Like I'm just, my mind is boggled by hearing about the reductions in the morning and then having to listen to this presentation in the end. So that just is kind of what's crazy. I don't think you need to respond. There's no way to respond right now. We have to wait to see what's in May, but that's what's kind of confusing and shaking us up right now.
Yeah,
Thank you.
thanks so much, Brandy. I will say just real quick, I did watch the press conference last Thursday, and one of the reporters specifically asked the governor's office how they define public safety. And there wasn't a really clear response. And so I think maybe that you're right, that some of the ambiguity around the public safety definition did kind of, contribute, or at least was a factor within the process.
May I ask one more question? This is Malika. So there's a fork in the road, I guess, as far as like the recommendations of SURSAC, and then this question of whether or not SURSAC will be able to submit a letter to the legislature. Because our recommendations are different than what was put forward by the healthcare authority. And so I'm wondering, do we have to, since technically we're supposed to be independent to a degree, do we have to, can't we just write a letter on our own behalf? We don't have to have HCA do that. That feels like that would be, because there's a departure in recommendation versus what, like SURSAC recommendation versus what HCA has recommended. So I'm just putting that out actually to the other group members, that maybe that's something we should think about.
And Caleb, go ahead.
Yeah, my rough understanding from the outside is, to Malika's point, is that HCA cannot submit something that is in conflict with the governor, since it has to be aligned with the governor's. You guys are within his scope, so I think it would have to be an external letter, is my sense of how things would work.
All right, thank you. Tony, you have any comment on that?
Just thinking about it, I think Kayla makes a valid point. And also, if it's coming from an educational or an informing lens, and we're coordinating that additional information being shared, then I don't know how much that's like not aligning with the governor's office priorities, but instead HCA is responsible for convening this committee, and through that responsibility, the committee has indicated that they would like to send additional information and clarification about this program, and we're just facilitating that exchange of information. It wouldn't be HCA taking a stance, but instead supporting the committee as we're directed to do by RCW. So but I think you can kind of look at it either way. And so I think that's kind of where I want to go back and just check with our legislative affairs team just get guidance, and we can follow up one way or the other. And then if it's like, HCA that feels this is outside the scope of our role as it pertains to this committee, then the committee obviously committee members can take whatever direction they feel is necessary at that point.
Okay, I don't see any other hands. Would we like to move on to the next agenda item, which would be Tasha?
Oh, hey, Blake, real quick. Sorry.
Go ahead, please.
We have a little time. Hold on. Okay, yeah, we got some time. I just wanted to flag some comments in the chat. Yeah, you're gonna try to get better about doing this because I, realize that the recording doesn't capture it. So let's see. It's listed. Lisa Dugard indicated the data and positive regard are welcome. It's just the lack of alignment. Understood. Emily Hero from Department of Health indicated the governor has a very narrow definition of public safety that he is using as he considers the budget. Brandy Flood, we need to educate them on the public safety aspects of RNP. Caleb indicated, I'll need to talk with my UW Gov relations folk, but I am supportive of a letter. I think Lisa's framing about how this ties into and supports public safety would be helpful language. And then Julian indicated supportive of a letter. And then Robin Cosette. Robin, you've made a couple of comments in your teams, the way teams, it doesn't indicate your affiliation. Can you just share real quick where you're from?
Yeah, I work with Destination Hub Hope and Recovery out of the Great Rivers region. I'm our quality assurance manager for the Recovery Navigator Program for
Awesome.
DHR.
Thank you so much. And so Robin indicated in the chat, 66% of all individuals referred in our county is identified as homeless without housing. And 34% of all referrals are from our partners in public safety, from 22 law enforcement agencies and jails. In agreement with what Rep. Davis already mentioned in the chat, in many ways, RNP is in alignment with the governor's priorities. So I wanted to share those comments from the chat before we moved on. And also, I think we have time dedicated for each agenda item. Kelly, if you want to present the agenda real quick.
I can do that,
yeah. Just a reminder, after each agenda item, we do allow time for SURSAC comments as well as public comments. And so just wanted to double check and see if there was anybody, I think we heard from SURSAC, any public comments based on that agenda item number 4?
Don't see any hands.
There's nobody in the room either, so.
Well,
I mean, there are, yes, yeah, clarity, yeah, there are people in the room, but no hands in the room either. Okay, Blake, go ahead, let's, at the, Kimmy?
Yeah, Kimmy.
Yeah, sorry, last minute, multitasking. So I just wanted to add that I do have, we were asked to do a presentation, possibly for next month's SURSAC, and I have 3 RMP participants that are ready, willing, and available to come and speak. It doesn't have to be in a SURSAC. I mean, it could be to any of you at any time. So if that is a possibility, please reach out and let me know. I can drop my information in the chat, but I think it's really important to hear from the actual individuals who are being helped by these programs, right? But I also have community-based organizations, owners of small businesses in Kent, parks, things like that, where RMP interjects and goes and helps clean up the community so that these people feel safe and also helps the participant, right? Because at the end of the day, it's the people that matter. So I just wanted to say that. Thank you.
Thank you.
Yeah, really appreciate that, Kimmy. And yeah, please feel free to put your contact information in the chat, and looking forward to hearing about the program next month.
We have Ally. Go ahead.
Hi, I just wanted to offer a public comment that I think it could be really valuable to get some police officers on board with this. Then the governor would be able to understand the public safety aspect. I know I live in Centralia, Washington, and our police chief is in love with this program and sees the value of it. So there might be some community partners in law enforcement that could help us with this.
Ally, real quick, just could you share are you just general public? Are you with an association or an organization or a treatment agency?
Oh, yes, I'm with CIHS in the Great Rivers region.
All right, thank you.
And Lisa.
Hi, sorry to chime in again on that comment. In a power hour, 2 power hours ago, we discussed the budget situation and the plan for a multi-sector advocacy effort that draws on each of the RNP lead and arrest and jail alternatives partners, reaching out to those multi-sector partners, including prosecutors and police and community leaders and business leaders like Kimmy and Ally just suggested. So that plan is underway. Please, like Malika said earlier, everybody, please look for that email from Carol Ann Sanders and please feedback suggestions for additional signers and partners. But yes, what you're suggesting is what we were predicting and it's underway. So need everybody to connect up with Carol Ann if possible.
All right, thank you. Anything else here before we move on to Tasha with research and data analysis? Okay, Tony, you have any comments before we get move on?
No, we've been, well, yeah, I guess I do. We've been talking about this for a couple of months. I think it first came up last year in fall, but wanted to kind of bring in research and data analysis, which is a division of the Department of Social and Health Services, to share some charging data relative to possession of controlled substance. And so I've been working with Tasha and her colleagues at RDA for the past couple of months, and I'll bringing in Office of Public Defense as well, because they had some of the same questions, but really just wanting to understand, since 5536 passed during the 2023 special session, and since those new laws went into effect, that recriminalized possession of a controlled substance as a gross misdemeanor, and possession of a counterfeit substance and possession of legend drugs. You know, what are we seeing across the state in terms of the frequency of charges being filed against individuals for those simple possession? And so, Tasha, are you here? Oh, yeah.
Yep, I am here.
Awesome. Thanks so much for being here, and thanks so much for putting this together and for your support. And I'll pass it off to you.
All right, thanks, Tony. So yeah, I am Tasha Fox. I am a research associate with the Department of Social and Health Services, like Tony said, in the Research and Data Analysis Division. And thank you, Tony, for giving a little bit of a background on these data tables that I'm going to share with the group. And feel free also, Tony, to kind of just jump in when necessary if you want to provide some additional context to some of these tables that I might not have. But basically, my presentation is just kind of going to be going through a series of data tables that we have been working on over the last few months regarding unlawful possession of controlled substances by various different, charges by county, charges by month, charges by court, stuff like that.
So this first one, this is actually unique interactions. So these numbers, I just want to orient you to the table. These numbers don't represent actual people. They represent charges. So one person may be showing up in these counts multiple times. And then another thing I just wanted to point out is that in counties where the numbers are less than 11, we did follow HCA suppression rules, and that's when you'll see this less than 11 number. So it's not that these data are missing, it's just that it's suppressed to protect patient confidentiality. So this first table is showing the charges by county, and I will slowly, it's a little bit longer than the screen, so I'll slowly kind of scroll down. Currently, the table is organized in alphabetical order, not, in order of the highest frequency to the lowest. But we can see that King County is showing, it's representing about 14.5% of the total charges, and then Pierce County 11%. Just kind of scrolling down, Snohomish at about 17% of all charges. And Tony, is there anything specific about this table that you wanted to kind of shed some light on?
No, just, looking at now, it looks like the percentages are the percent of the total sample of possession charges across the state. And so when you indicate for Pierce County 11%, that means that of all the total charges filed, Pierce County comprises 11% of those charges. Is that right?
Yes, correct.
And then maybe just flagging it's something that we can kind of consider for like the next iteration of this when it's updated is like weighting those. If there's some way to identify with that kind of percent of total charges, if they're based on the population or maybe even like a control group within that county to identify if it's like a representative percentage of that population or if it seems disparate.
Yep, good idea. I know that we had talked about that at some point, and I even brought it back to my team within the research and analysis division, and we kind of discussed possibilities, and it wasn't possible quite yet. There were just a bit of problems with some of the data, but definitely something that we can work towards and try to include in a later iteration because it would be helpful.
Thank you.
Are there any questions? Oh, sorry, go ahead. I think I heard someone talking.
Oh, it looks like Lisa has a question.
That's an old hand. I'll take it down. Sorry.
Oh. And yeah, if anybody has questions, feel free to just jump in. But I
Do
will
we
move on to
have
this next.
demographic,
Go ahead.
racial demographic breakout? Sorry, you said that and then we all
No
talked at the same
problem.
time.
That is okay. So that is actually something that Tony had talked with us about last week. And so it's on our radar for sure. It's not something that we were able to incorporate into the tables that I have today, but something that we hope to be able to incorporate soon. That's kind of like at the top of the list for next steps.
But and adding to that, surprise, I reached out to Office of Public Defense and they shared their data set, which did have some demographic data. And so it's a different data set. So there's some kind of footnotes there. But if we have time, I can share my screen and share that today. But we're also going to try to attribute it to RDA's data set, which has just a little bit a different scope. Sorry, Tasha, throwing a curveball in there. I didn't have a chance to check with you about that.
Oh, no problem at all. I do not mind. Happy to speed through this and share some of this time with you so you can share that with the group. I'll move on to these next two tables. Luckily, they both fully fit on the screen, but this first one is showing the number of unlawful possession of controlled substance charges, again, not people, but charges by month. And going through June of 2024 is just the most recently refreshed data that we have access to when we made these tables. So that's why it's June and not, December. But again, that's another thing that we could hopefully incorporate if we work on additional iterations of these tables. But looking at this, you can see that between July 2023 and June, the number of charges fluctuate a bit, but steadily do seem to be kind of increasing, a huge difference between July of 2023 and June of 2024. And then in this next table, you can see the charges by court type. So again, this other unknown is suppressed, probably didn't need to suppress that particular line because we don't know what court those were attributed to. But for the vast majority of the charges, we can see what court they were filed with. Are there any questions about these two tables or anything, Tony, that you wanted to add?
No, I mean, obvious, I think it's pretty blatant that the frequency of these charges being filed has increased over the period of time that was shared. The big jump in August makes sense because I think, and I don't know if Rep. Davis is still on the call or somebody could, but I believe that certain elements of, the possession change, the criminal code associated with simple possession changed July 1st of 2023. And so there was a little bit of delay there before it jumped from 199 to 637. But also just wanted to flag, and I know you have another table that you're going to share in a second, that these are charges associated with simple possession, so counterfeit, controlled substance, legend drugs, but they are also accompanying other charges. So this isn't saying 11,000 charges over this course of time that are just simple possession. It's 11, and some of these cases have other crimes that were charged simultaneously. But I know you have a table that shows of these 11,000, how much of them were in a situation where they just charged this individual for nothing more than simple possession. So like no driving on suspended license, no other criminal charges. And so I think that's really important to flag because it's a kind of additional layer of clarity about the data set. But it was still really interesting to see that high of where 51%, half of these are just simple possession charges. So it's not like a situation where somebody was driving on suspended license or had a theft 3 or where it was engaged in other criminal activity and it just happened to I also be possessing a controlled counterfeit or legend drug. But situations where really somebody was doing nothing more than just possessing the controlled substance.
Yep, very good point, and thanks for kind of covering that last table
Sorry.
for me.
Sorry.
No, it's
Sorry.
fine.
This is really interesting, and it's really important to track, especially in the context of the conversation we've been having about Recovery Navigator Program. Sorry.
Mm-hmm.
Feel free to jump back to where you were. Sorry, Tasha.
No problem at all. I truly do not mind. But yes, so yeah, pretty high percentage of the charges were not accompanied by other offenses, which is was a bit surprising. So I didn't hear any other questions about these two tables, so I'm thinking I can move on to this one, which is the charges by agency. And this table is very long. I'm not sure if this group would want me to slowly scroll through the whole thing, but I was thinking, let's see, maybe I can sort of Okay, so you can see all these top ones. I did it in descending order, but because of the way the suppressed cells are written, it puts them all at the top, but you can see a pretty large proportion of this table is agencies with less than 11 charges. So kind of, if I'm going too fast, if anyone wants me to stop and look for a specific agency, just let me know and I'll scroll back up. But when I get through these, you can see there's a pretty big chunk here of over 4,000 charges where the agency information is either missing or unknown. But just beyond that, you can see which specific agencies tend to have the highest numbers of charges. So the Everett Police Department is at the top of the list for those where we have the agency information. Now let's slowly scroll down.
And while you're scrolling, I'll add that something that we talked about when meeting with Tasha and her colleague was breaking this table out by looking at just those situations where it's a simple possession charge as a standalone charge and other ways. But if anybody in the committee has any recommendations or suggestions or different ways that we can kind of bring these data to the meeting, yeah, please reach out because we want it to be helpful, useful, and yeah.
Sorry, I'm taking a quick pause because I'm writing down a note.
So this is hard to review all of this, like, in the context of this meeting. Will we get time to, or will this be sent out or available for us to look at later?
I don't know if that's a question for me. I'm fine, Tony, if you want to send these tables out. I can, I sent you the most recent version, but I can send it again after this meeting just in case like there's any small minor edits that any tweaks that we make, and you can send it to the group if you're wanting to do that. Because I agree, yeah, this table specifically is almost 250 rows.
Yeah, absolutely. I mean, if RDA is okay with sharing this externally with the public, we can send it out with the notes.
Yep, that sounds good to me. We, with these suppressed cells, that makes it perfectly fine to send this out. Are there any other questions about this table?
No, it just looked like Everett was the leading, I guess, arresting or citing agency, Everett Police Department.
Yep.
Caleb, go ahead.
Yeah, just really quickly, and I don't know on the unique people tab, maybe it's more appropriate to do this, but obviously a rate would be super helpful so we can see if there might be any differences between, I don't know, King County and Spokane County, for instance. And then I'll also share a link to the state crime lab data, which is indirectly related to this. These are, this is local police evidence testing by the state crime lab. I think we have it by county. Those are cases that are generally getting referred or being considered for prosecution. So you can see a little bit of which substances are there. So some complementary data, but again, ultimately the rate would be super helpful just so we can make sense of this. And I had a note in there. I trust RDA to be thoughtful about, what's the appropriate way to create a crude rate, whether it's deduplicating data, an adult population or whatever. But, even if it's not a perfect rate, I think it looks like it's incredibly variable. And that I think would be helpful to see. Thanks.
Yeah,
Thank you. Susan?
Hi, Susan PC, regional admin. This is great data and I really appreciate it. As I'm initially looking at it, I'm I am wondering if there is a way to have a context with general population compared to these numbers. The numbers are great, but without knowing the size of these police departments and the populations they serve, it's really just a number in, with no context. So don't know if that's possible, but just something that I thought would be really useful. And thank you. I do appreciate these numbers.
Thank you.
Yeah,
Lisa?
thank you. So,
Oh, go ahead.
oh, go ahead.
Go ahead, Tasha, go ahead.
Oh, no, I was just agreeing, and it sounds like, so adding some of those rates and that, weighting it with the population would really be helpful in interpreting these numbers is what I'm hearing. But yeah, go ahead if Lisa had a question, or was that just
Lisa?
talking?
Lisa, go ahead.
Thanks. I just wanted to make sure that do we know whether these are filed charges or charges referred for filing? And why that matters is that arrest diversions in some jurisdictions are treated are reported as referred for filing, though they will not be filed. So while the person diverted completes their intake essentially to lead or RNP. So is that clear what those numbers represent, whether it's filed or referred for filing?
I would need to double check on that. I believe it's charges that were filed, but I am not certain. So I will have to double check on that.
I think that would be super helpful for, local sort of efforts to understand whether this does or does not include diverted cases, which would mean something quite different. So thank you.
And it looks like, Tasha, I wasn't sure if you could see the chat, but Kevin noted that the technical variable being used is CJ file date. So it does sound like these charges are being filed.
Great, thank you, Kevin. And just so people in the group know, Kevin is my colleague in RDA, and he is the main person who worked on these tables. So his answer would be the one that I would trust. He would be the person I would ask. So yes, it sounds like these are charges filed, not just referred for filing.
All right, thank you. Any more questions for Tasha?
Okay, if there are no more questions, then I will move to the next tab, and these are the actual unique people, so not just the number of charges. And so with this first table, it has some of the, we already reviewed the unique charges filed by month on the previous tab, but this is where you can see the actual number of people and how that has fluctuated over the July 2023 through June 2024. So just like with the unique charges, there's a little bit of fluctuation, but overall it has significantly increased since July. I'm just giving it a few minutes for people to take a quick review of that. And I'm not hearing any questions. If there's anything in the chat, let me know, because I'm not monitoring the chat. Okay, not hearing anything, so I will move on to the unique people who were charged by offense description. So one thing that I will just note about this table is that the data we receive from WISUP and the way in which we pull the data to make these tables, there are a few types of charges that sort of slip through that maybe shouldn't be necessarily included. So I just wanted to point that out. There are not a lot, but for example, I think there was like a graffiti type of charge. So you may see a couple charges with fairly low numbers that maybe shouldn't be included. And so just wanted to make a note of that. But here you can see in order from the most frequently, the numbers with the highest frequency of people who have gotten those charges down to the fairly large proportion at the bottom where the numbers are suppressed because the numbers are very low.
And just
And
one.
then oh, go ahead.
Yeah, I'm sorry, just real quick on that table. The second row is the use in public. That was a change, just a reminder, as part of 5536, when the laws were changed to be gross misdemeanors. It also added a component where knowingly use of a controlled substance, counterfeit, legend drug in public was also criminalized. And so we've heard in this meeting in the past that, you know, this public use element and being able to arrest, charge, cite an individual solely for knowingly using a drug in public was something that we wanted to track, or at least, you know, as part of our R&P data collection efforts as well. I think that was a recommendation to include those use in public variables on our data collection. And so just wanted to flag that. Yeah, Tim, you're in the room.
Yeah, I am in the room, but I'm hearing my echo, which is making me uncomfortable. It's
that I wasn't muted. Thank you. So I am looking. I see the third line is possession of paraphernalia, and then the fourth is use of drug paraphernalia. I'm assuming without actually looking at case reports, we wouldn't have any information regarding what type of paraphernalia that would be. I need to make wide sweeping changes to our paraphernalia law that was more focused on the distribution and selling or giving of paraphernalia, but not necessarily possession. And I just want to, flag for folks awareness that 6950-41-2 was not amended, and that does give legal protections for individuals to use and possess paraphernalia if you're over the age of 18, and it's sterile hypodermic syringes. And I know with the ubiquitous nature of people smoking drugs right now, I just want to flag that might be where that's coming from. I really, just for my own awareness, would be really interested what those case reports look like. I know we may not have access to that, but I'm assuming that most of those might be A, paraphernalia with residue in it, and or B, paraphernalia that is not hypodermic syringes. So that looks, that's almost 500 arrests related to paraphernalia.
Thank you for providing that additional context. That's helpful.
It looks like Robin had a question in the chat. You see it, is anything being done to see some historical data compared to prior years and felony charges prior to Blake changes? It would be helpful to see if there's any variance. This type of data would be helpful for programs on a regular basis, so we can shift our efforts to focus on agencies that are those high flyers.
Yeah, that's a good question. So a lot of these tables, actually, Tony, you may be able to provide some of the background. I know that initially we had looked at some of these numbers a couple of years ago, not this in depth, but we have looked at some of the historical data, not a lot. It's not something that we included in this iteration of the tables, but definitely something that that we could do. And then Tony, I don't know if there was anything else you wanted to add.
No, I was searching my my folder because I know those earlier data sets for like state fiscal year 23 and 22, they've definitely been recently pulled, because I think we were looking at them when 5476 was passed. And so, definitely they're out there. And so I think it would just be a matter of kind of compiling them and then having a year-to-year view. And so, yeah, we can take that back. But it looks like Lisa also noted in the chat that Scott Greenstone from KUOW is doing that as well, I guess, as part of some sort of news article.
Okay. And so this next table is basically what Tony was just talking about with some of the public use. And it's the same numbers just pulled from this table. One of the requests that we had was to display some of the public use charges by month. And so that's another thing that we can kind of incorporate into a future iteration of these tables. We weren't able to do it for this time to show it by month, but you can still see just the totals of people, not charges, but the total number of people who received a charge related to a public use offense. So stay tuned for more details on that in the future. And then this is the same information over here too, but it's just showing the charges or the people who are charged by RCW title instead of the offense description, and then an additional table with just those details of what the offense description is and then the RCW title that it is stemming from. Are there any questions about any of these? Or Tony, if you want to jump in and share some of the racial demographic tables that you were talking about.
Yeah, absolutely. And then just flagging in the chat, Lisa Dugard indicated, asked, do these figures count charges under local ordinances, not the state RCW? And then Kevin responded, to the best of my understanding, yes.
Great, thanks, Kevin.
And then, yeah, let me present what, and then we should have some time for, it shouldn't take too long. I just need to pull up this chart here. And so we've been having this kind of ongoing conversation with Office of Public Defense. Grace O'Connor is leading some of the Flake response efforts over there. Grace wasn't able to make it to this meeting, but we have this kind of shared interest in kind of tracking the charging filing data associated with simple possession. And they reached out to the Administrative Office of the Courts and requested a similar data set. Grace did want me to preface sharing this with that these are not necessarily complete nor accurate, but in terms of the data set that they received, which you'll see the total the total sample size is a little different. We're looking at 13,000 cases that fall underneath those similar criteria in terms of simple possession and knowingly use of in public and counterfeit and legend drugs. And of that, here is the chart breakdown by gender. I didn't have a chance to do the percentage, but maybe there's a math whiz out there that can do it really quickly. But as you can see, around 3/4 male compared to a quarter female, and then we have some unknowns as well. But I think the question earlier was around the race breakdown. And so with that same data set, here is the chart associated with race. So you'll see American Indian, Alaska Native at 3%, Asian at 3%, Black, African American at 11%. We have multiracial, Native Hawaiian or Pacific Islander, and then unknown as well. And so
demographics that were arrested.
Yeah.
Okay.
Tim asks, and then 75% white or Caucasian. That's this kind of brown color on there. I don't know why it didn't show up on the table, but yeah, this is from that same sample of charge filing data. Sorry, there was a question. Since I'm presenting, I can't see my teams as well, so just feel free to unmute, or Blake, if you can kind of help any questions.
Yeah, you bet. I did not see any questions or any hands. Are there any questions for Tony regarding this?
I'll just move on to ethnicity real quick. And try to zoom in. You can't zoom in. It's not letting me zoom in. So sorry, you're gonna have to zoom in on your own. We have ethnicity, Hispanic or Latino at 11%, not Hispanic or Latino 47%, with 34% unknown. With that same general sample, although queried a little differently than RDA given the different total sample size. But again, charges related to simple possession post-Blake. So I'm going to stop sharing because I want to just check the chat.
There is one question in the chat there from Emily. Can we find out on the paraphernalia charges how many had other charges, another charge, i.e., were there any paraphernalia charges without any other charge?
Yes, that's something that we should be able to do. I will make a note of that.
Thank you.
Can we also get it broken out according to location?
I think that should be possible.
Because that would be really an interesting thing to look at, considering there are some places that created local ordinances against harm reduction activities.
So just so I understand what you're wanting, would that be the same? So would you want the number of paraphernalia charges? Would you want this information for all paraphernalia charges, or just those that were not accompanied by another charge?
For paraphernalia that didn't have any other charge, and but then also have it broken out according to where, like
okay,
or like what police department or whatever. Yeah.
Okay. Yeah, I just wanted to make sure that was just for those charges that didn't have an accompanying charge and not for all. Okay.
And it might be actually interesting to look at the demographics of those charges too. That would be great. Sorry to keep layering.
That is okay. We will figure out what's possible and definitely keep Tony and everyone in the loop with what we're able to produce.
Thank you. Anything else for Tasha? And Kelly added a bunch of links to the chat there. Thank you, Kelly.
That's all the links from today's meeting for everybody. So if you just want to copy and paste it, you can.
Thank you. All right, so we are close to the end here. I think we've had a lot of comments today. Kelly, did we want to move with next month's agenda here, since we only have 5 minutes left?
Actually, Blake, real quick, if I can just thank you, Tasha, for your time today. Thanks for being here and presenting these data. And Kevin, thanks for your support on this. And I think we have some good feedback and some good recommendations, and then we'll try to kind of maybe in the next couple of months, 2 to 3 months, we can bring back an updated representation of those particular data associated with simple possession and drug paraphernalia. And so thank you again. And also just wanted to flag a comment in the chat real quick from, I lost it. Sorry, give me a second. Where'd it go? Shireen Hunt from Merit Resources indicated from March 29th, 2023 to February 28th of 2025, the city of Kennewick referred 60% of possession of controlled substance cases to the R&P pretrial diversion program. R&P celebrated 8 graduates from the pretrial diversion last Friday. And I didn't want to end this meeting without highlighting that and making sure it was part of the recorded record for this this meeting. And Shireen, thanks so much for sharing that. I don't know if you want to go off mute and share anything else or add to it, but appreciate it. And then Caleb noted a reminder that folks might want to be tracking HB 1574 that addresses Good Samaritan protection expansion, protection for participants of drug checking programs, clarifying healthcare organizations can disseminate safer use supplies, removing the ability of local jurisdictions to ban harm reduction services. 3 of these align with intent of past SURSAC recommendations. And yeah, and that will be a bill that will include Kim Wright, who is going to provide a legislative update today, but we ran out of time. We'll provide an update on some kind of where some of the legislation that we talked about in the last meeting, where it is in terms of the legislative process. Did it pass the fiscal committee cutoff that was this last Friday? And are they still moving, or would they be considered, that they didn't meet the cutoff of either the policy committee or the fiscal committee? She also had just some other additional helpful information. So we'll try to get that out in an email to just kind of provide an update about some of that key legislation for policy and program bills moving through the legislature right now. Okay, that's it. What was the last agenda item? Sorry, Kelly.
Share the agenda. I have it. All right, just real quick, folks. This is the April agenda so far. It can also change in the next month, but we have myself and Tony doing the welcoming, public comment, and community member announcements and comments. Blake, and then we have lead next month, lead support bureau, doing a lead education series part 2, and then we have Susan from R&P highlights. And then we have more public comment, committee member announcements, and then we review next month's agenda. This is what's currently on the agenda for me.
Hey, can you know what?
Yeah. And Kelly, if we have time for one more announcement.
Oh yeah.
We will be hosting, one of the SURSAC's recommendations submitted to the legislature was to put together a safer supply work group to examine different models of safe supply and how that might be able to be incorporated in Washington. We are working with, so that report has been submitted to the legislature, and we are working with Health Management Associates, who is our contractor who facilitated and convened those work groups, to come up with some informational training and sort of town hall opportunities to better educate the public and our legislators about safer supply, and specifically those recommendations in Washington. So on April 7th at 11 a.m. to 1 p.m., so right after the SURSAC meeting, HMA will be hosting here at Healthcare Authority Cherry Street Plaza in the same room that we do SURSAC. They'll be hosting kind of a town hall Q&A and informational session for the public on safer supply. So we'll send out that flyer and information as it becomes available, but given that it's just about a month out, I wanted to give folks on this committee and anyone in the public who might be interested a heads up.
What was the date again? I'm sorry, I didn't hear you.
That's okay. It's April 7th from 11 to 1. So right after the SURSAC meeting.
Okay, thank you.
And then so we'll be here in person again next month on April 7th for the SURSAC, and then that will follow. So if anybody from the committee wants to come join us, we're always here and would appreciate the company. And it would be good timing for next month's meeting, because then you could just stick around for the HMA led focus group. So thank you, Sarah.
So it won't be online too. It'll just be in person
Great question.
for the safe.
I'll check if we can do a hybrid option. Let me get back to you all on that.
We should be able to do hybrid, but yeah.
I imagine we would.
We will confirm. Good question. Okay, with that, we're at time. 11, appreciate everyone showing up today and appreciate the conversation. And we're definitely taking a lot of feedback around the proposed budget reductions. And I will circle back around with the committee regarding the request to submit a letter to the legislature. And we have some other action items. I can't think of them off the top of my head, but we'll try to allow time in future meetings to kind of go through those. And then we'll share the RNP data presentation on our website, and then also get the possession charge data document out as well. So thanks everyone, and have a good rest of the week, and we'll send some updates through email.